So I'm Naomi Cottam. I work for Bristol Wellbeing Therapies and I'm a psychological wellbeing practitioner. So it's quite a long name, but all that means really is that I'm trained to work with people experiencing common problems, so things like depression and anxiety. So we use an evidence-based therapy, so cognitive behavioural therapy. And really it's about helping people to become their own therapists, so kind of acting almost like a coach, using guided self-help to support people to change perhaps how they think and their behaviour and how they kind of physically feel. So we're part of, it's a nation-led programme, it's called Introducing Access to Psychological Therapies. So really, this service is kind of a primary care service and it's really important for us that people can access the service because these problems are kind of so common and affect about 1 in 4 of us. So because of that, people can self-refer directly, so they can give us a call on our number and book in for a telephone assessment. So they don't necessarily need to kind of speak to their GP if they don't want to, or they can just go to their GP and ask to be referred. Yeah, so it would start with a telephone assessment. So that would be anywhere between perhaps half an hour, 45 minutes, just talking a bit about what the main problem is at the moment, go through some questionnaires, and then you'd talk with the practitioner about different kind of treatment options. So for example, we offer psychoeducational courses, so it's more about kind of teaching the skills to be able to kind of help yourself, so not so much kind of what we would normally think of or imagine kind of in a counselling group, for example. It's very much kind of sat in a classroom style, learning those techniques, and then you'd kind of go away that week and come back and put them into practice. For some people, a group is understandably really scary, so some people might prefer kind of one-to-one sessions. So we offer low intensity CBT, so that would be up to 6 sessions with someone like myself. So looking at perhaps challenging negative thoughts, so looking at the evidence for and against those thoughts, because they have a really big impact on how we feel physically and our behaviour. Perhaps if we're depressed, we might focus more on changing our behaviour. So it might be gradually kind of starting to do those things that we've stopped doing. So it's very much about the here and now, really changing that. And then we also offer kind of high intensity sessions as well. So that's up to 12 sessions with someone who's had further training. And generally that's better for people who've kind of been experiencing these problems for a long time, perhaps moderate to more severe depression and anxiety. And it would be very much based on the similar kind of principles, but just kind of in a bit more depth really, I suppose. I suppose I like to think that we're quite approachable, and that kind of anyone can refer, and I think we're really lucky to work with such a friendly team. I really enjoy working within this service, so I think approachable. I suppose short term as well, so up to 12 weeks for one-to-one sessions, and I think collaborative as well, maybe, so about kind of listening to the clients and what they would like to get from the service, and coming to that joint understanding really and making a joint decision about treatment. Yeah, absolutely. I think that's so important, isn't it? That kind of, liaising with other services. So I guess we're kind of I suppose a lot of people come into this service because we can self-refer, patients self-refer. So sometimes when someone's kind of experiencing a crisis, we might refer them to, the secondary care services, so Bristol Mental Health crisis team. So we would liaise with them. Perhaps when someone's being discharged from that service, we might liaise with them as well about kind of what suitable treatments might be best, as well with kind of other GPs and so on. And then within our service, so we're based in, it's kind of any qualified provider system. So if you imagine we're kind of the central place where everyone refers to, has the assessments, then we can refer people to other services, so like Oasis Talk, GAN West, Second Step, so on. So they offer similar treatments as well, but they might be a little more specialist in certain areas. So certainly we can refer to them. I really enjoy the variation part of my job. I think I get to work with a lot of people from a lot of different kind of walks of life, and I'm always kind of amazed really at how resilient people are. I think it's really satisfying to be able to help people to help themselves. I think that can be really empowering actually, so I think that's what I enjoy most really. I really enjoy kind of the variety that comes with assessments. So, you know, I've never really know who I'm going to assess or have that much information, which is, you know, I quite enjoy that actually, kind of speaking to lots of different people and also supporting people to help themselves in treatment really, seeing people progress with that as well. It's really rewarding.